Okay, so let's talk about the ninth month of pregnancy. It's gotta be one of the most intense, exciting, and just transformative times in anyone's life. This is it, the final stretch, where everything shifts from just being pregnant to actively getting ready for birth. In this explainer, we're gonna navigate that final countdown together. So, are you feeling excited? Anxious? Maybe a little overwhelmed? Or maybe all of the above in the span of 5 minutes? Trust me, that is completely normal. One moment you're thrilled, the next you're thinking, what have I done? Our goal here is to just cut through that noise, give you the essentials, and bring some real clarity to this final countdown. You know, the best way to wrap our heads around all this is to think of it as two parallel journeys happening at the exact same time. First, we're going to dive into the incredible final upgrades your baby is making inside the womb. And then we'll turn to you and the grand finale your body is orchestrating for their big arrival. So let's start with the star of the show, right? That little person you've been growing for almost 9 months. They are seriously getting ready for their big debut, and these last few weeks, they are absolutely crucial for their development. As you enter this month, your baby is technically considered late preterm. Now, what does that actually mean? Well, most babies born now do really, really well and can even grieve on their own. But, and this is a big but, they might struggle a bit with things we take for granted, like feeding or controlling their own body temperature. Those final weeks inside are like the finishing touches that just make a world of difference. One of the most critical things happening right now is the production of this substance called surfactant. The easiest way to think of it is kind of like a biological lubricant for the lungs. It coats the inside of all those tiny little air sacs called alveoli, and it makes sure they don't stick together when the baby exhales. And this is why it is such a game changer. With enough surfactant, those first breaths of air are so much easier because the lungs can expand and stay open. Without it, the air sacs can collapse, which makes every single breath a huge struggle. It's honestly one of the biggest reasons why getting to full term around 39 weeks is so beneficial. And it's not just the lungs, right? The brain is in total overdrive. I mean, in the final trimester, the baby's brain more than doubles in size. The surface gets all wrinkly and folded, which boosts its processing power. And the nervous system is basically running drills 24/7, practicing all those essential skills like feeding, breathing, and regulating body temp for life on the outside. And get this, while all that amazing stuff is happening, your baby is packing on the pounds at an incredible rate, about half a pound every single week. They're not getting much longer, but they are definitely getting heavier. And look, this isn't just about getting chubby for the sake of it. This new layer of fat is so important. It provides insulation to help them stay warm after birth. It acts as a crucial energy reserve for their first few days of life. And yeah, okay, it's also responsible for those irresistibly cute, chubby cheeks. All right, so let's switch gears and talk about that second journey, your body's grand finale. And let's be honest, this can be the toughest part of the whole pregnancy. Your belly is heavy, everything aches, everything feels like a massive effort. So let's talk about what's really going on. I really want this next part to sink in. If you feel like all you can manage to do is sit on the couch, that is more than okay. Your body is doing something incredible, something that burns a ton of energy. You are literally building a person. So please be good to yourself and rest without any guilt. You know, a lot of those aches and pains you might be feeling, you can pretty much thank one hormone for that. Relaxin. It does exactly what it sounds like. It relaxes your ligaments and tendons, especially around your pelvis, to make space for the baby to pass through during birth. It's totally essential, but wow, it can definitely cause some serious discomfort. The good news is there are some simple things you can do to manage this. First, try to avoid any sudden, jerky movements. When you're getting out of bed or the car, really focus on keeping your knees together to keep your pelvis stable. And at night, sleeping with a pillow between your knees can be an absolute lifesaver. It provides incredible support and just relieves that pressure. And oh my gosh, sleep. If you're wondering why it feels literally impossible right now, you are so not alone. It's a perfect storm, right? Your bladder is under constant assault, your hips ache, the baby decides to have a dance party at 2 a.m., and your body is just naturally more alert as birth gets closer. Oh, and the dreams can get seriously weird. The goal isn't perfect sleep anymore. It's just getting whatever rest you possibly can. Okay, so now let's talk about where these two journeys, yours and the baby's, really come together. The ninth month is when your medical care really ramps up, with practical steps to monitor both of you right up to that finish line. Get ready because you're probably going to start seeing your doctor or midwife every single week now. At these appointments, they'll keep a really close eye on your blood pressure, and they'll also be checking the baby's heart rate and their position to make sure everything is looking good and progressing as it should. So, one key test you'll hear about is for something called Group B strep, or GBS. It's a very common bacteria that tons of people carry without any problems at all. The test itself is super quick, just a simple swab. If it comes back positive, it's really no big deal. They'll just give you some IV antibiotics during labor to make sure the bacteria doesn't pass to your baby during birth. All right, this brings us to the big one, the question that's on everyone's mind in the 9th month. Is this it? Right? Every little cramp, every single tightening can feel like it might be the real deal. So, how do you actually tell the difference between a false alarm and go time? Well, the key difference really comes down to the pattern. True labor contractions, they become regular, stronger, and they get closer together over time. And they don't stop if you rest or change positions. But Braxton Hicks, those practice contractions, they're usually irregular, inconsistent, and they'll often just fade away if you lie down or take a walk. So when is it time to head to the hospital? A great rule of thumb is what's called the 5-1-1 rule. The first part is the 5. This means your contractions are coming consistently every 5 minutes. And the first one, that means each one of those contractions is lasting for 1 full minute. And the final one, that means this whole pattern has been going strong for at least 1 whole hour. So 5 minutes apart, 1 minute long for 1 hour. That's your 5-1-1. Once you hit that, it generally means labor is active and it's a good time to call your provider. But, and I really want to stress this, the 5-1-1 rule is just a guideline, okay? It is not a law. You should always call your provider sooner if your water breaks, if you have any heavy bleeding, or if you notice a big change in your baby's movement. And most importantly, trust your gut. If something feels off, it is always better to get checked out. Look, for 9 whole months, your body and your baby have been on this incredible, perfectly timed journey together. Everything has been leading to this one moment. The preparation is done. All that's left now is the first hello.